Hi, everyone. I'm Deborah Kan, founder of Being Patient. Welcome to Brain Talks. Today, we're going to talk about why women tend to get Alzheimer's disease more so than men do. Previously, it had been thought that women live longer, therefore, they're more susceptible to Alzheimer's disease. But more research is going into why the disease impacts one gender more than the other. Well, I'm happy to have joining us Dr. Marie Pasinski. She's from Harvard University and a neurologist at Mass Gen. She's the author of a book called Beautiful Brain, Beautiful You. Thanks so much for joining us, Marie.
Thank you, Deborah.
So let's just start with how you are looking at gender in terms of, who's more susceptible to Alzheimer's and who's not.
Mm-hmm. So as you mentioned, for a long time, we knew that women have developed Alzheimer's more frequently than men do, but we attributed it to our increased longevity. But what we now realize is that even when you exclude that, women are more likely to develop Alzheimer's 2 to 3 times more likely than men. And the other burden that women carry is that women are more likely to be the caregivers of patients with Alzheimer's. And so in many ways, this is a woman's disease. And for too long, we haven't focused on that. So I've been very interested in trying to figure out, what is it that makes women more susceptible? And while we don't know the answer to that, what I think is really important is that women have more risk factors than men do for Alzheimer's. There are a number of what we call modifiable lifestyle risk factors. So these are things that we have control over. And for women, this is especially important because we have more of those risk factors.
So we know that plaque appears in the brain, decades before you may see a symptom of Alzheimer's disease. What is your research looking at? When we talk about stress, what really impacts the brain, and what do we know? What factors can we really change to minimize our risk of getting Alzheimer's later on?
So when we think about Alzheimer's, most of us just think about the diagnosis of Alzheimer's, but that's just one type of dementia. So dementia is the umbrella term. Alzheimer's is clinically the most common diagnosis for dementia, but in fact, there are many, many factors that contribute to how our brain functions. And the most common pathologic diagnosis for dementia is not Alzheimer's. It's actually what we call a mixed dementia. So when we look under the microscope, we're seeing more than just Alzheimer's disease. So someone may have some Alzheimer's disease, they may have some underlying vascular disease, and then there are many, many other factors that could be playing a role. If someone drank a little too much alcohol, that can impair cognitive function. So all these things kind of come together to impair cognitive function. And so it becomes really important for us to be aware of what these risk factors are and know that we can take steps to decrease our personal risk of Alzheimer's.
We have a question that's coming in. I think a lot of women, I know when we're pregnant, I've had 3 kids. When we're pregnant, we tend to think, oh, my memory is getting worse. As we get older and women face menopause, there's hormonal changes. So how much do we know hormones may factor into making us more susceptible to disease, or does more really have to be studied about that?
There's a lot that needs to be studied. We don't really know how hormonal changes really affect the brain. But what we do know is that hormones affect women in lots of ways. For example, it interferes with sleep. And we know that sleep is one of these modifiable risk factors. So, often when women are young, if they have discomfort with their periods. They may not sleep as well. Certainly during pregnancy, it can be hard to get a good night's sleep. And then when we have children, breastfeeding, that any woman who's breastfeeding is sleep deprived. And what we realize is this really continues throughout a woman's life. So raising children decreases our sleep. We know that women who have children are more likely to be sleep deprived than men. And then as women, once the kids are raised, then often we're caregivers and taking care of parents or ailing family members. And so again, that takes a toll. And we really, it's so difficult to kind of quantify that effect. But we do know that also that women are more likely to suffer from insomnia than men are.
So is your research then focusing on what are the points that really could factor into more stress and more we know if you're not getting your 8 to 9 hours a night, that's bad for your brain. That's been studied in quite a number of times. So is it trying to really kind of connect the dots between what's the difference between our lifestyles, men and women, that actually make us more susceptible rather than maybe something within our genes?
Yeah, we don't really understand that. But one thing that I think is very interesting is that so genes are important. We know that plays a role, but there's this whole new area called epigenetics, which helps us understand how the lifestyle choices we make actually affect gene activity. So the lifestyle choices we make can turn genes on or turn them off. And so again, this gives us reason to really think about these modifiable lifestyle risk factors for Alzheimer's that we have the power to change.
So do you, one of our viewers is saying that being a parent and worrying is a long-term, I think my mother-in-law once said to me, you never stop worrying, just one worry replaces another. So is that could that be really putting us at more risk, the fact that we maybe worry more about things than men do?
Well, we know that worrying is not productive. It's not good for our brain. It's very hard to measure the effect of stress on the brain. First of all, stress is impossible to really quantify. What's stressful for one person is not necessarily stressful for another, and even within an individual, at one point in your life, something may be very stressful, and then maybe the next day it isn't. So there are many factors, and it really is more about how we manage stress and how it affects us. The best way to really quantify stress is by self-reporting. So if someone feels like they're under a lot of stress, that's the best indicator that they are. And it's important to recognize that and for women to get support. I think that's huge. I think women are shouldering, so much responsibility. We're juggling our careers, we're juggling our families, we're the caretakers, and I think we need to take care of ourselves.
Do you, we have a question coming in asking that, we all know that exercise is good for us, right? We've been told that over and over again. If you can choose one thing, choose exercise. Did you factor any of that into, is it does exercise negate maybe some of the extra layers of things that make women more susceptible to this disease? Is there a way to figure out, is it putting a puzzle together? Is it a equilibrium, so to speak? So what do we have control over, in other words, at this point in time, to know that we're really helping our brains and maintaining brain health?
Okay, so exercise is one of the very best things we can do for our brain, staying physically active. Looking at the risk factors overall, the best study was by Barnes. That what they tried to do is estimate the risk of the individual risk of 7 modifiable lifestyle risk factors, and what they found. They came up with 7, and these were, let's see if I can remember these, low educational attainment, or lack of cognitive stimulation, physical inactivity, depression, midlife obesity, hypertension, diabetes, and smoking. And from that study, and again, that didn't include all of the other risk factors. There are other risk factors like sleep and, as we talked about, stress and so forth. But in that study, what they found is that the #1 risk factor in the United States was physical inactivity. So this is huge. And, you know, traditionally, when you think about it, women have not been as physically active as men. You know, I think about my mother, who had Alzheimer's disease, and you know, her generation, they didn't do any type of physical activity or exercise, and even when I was growing up, there weren't, you know, that was before Title IX, there weren't the sports teams for women. You know, in general, women just are not as physically active, and there are actually studies showing that you know, throughout life, women are less physically active than men. And part of that may be due to, you know, child rearing, other responsibilities. Again, we're juggling a lot of things.
Is there a way, though, to determine how much of that factors in? So, for example, now women have been exercising. I mean, wait, when did Jane Fonda come into our, you know, is it the 80s or so, yeah, where the whole aerobics revolution came on? So is there a way to measure, do we have enough data to say, actually, you know, exercise is helping us to maintain our brain health? And secondly, a lot of what we talk about, like exercise is good for men or women, right? And so where's the differentiation in that, in terms of maintaining our brain health?
So it's really impossible, when you think of all these factors that contribute to our cognitive function, to kind of tease out, you know, how much does this contribute? And again, it's going to vary with, you know, any individual. But again, in the US, physical inactivity is considered to be the #1 risk factor. And I think for a woman who's trying to juggle a lot of things, that, you know, it's hard to find the time. And so one of the things I recommend is avoiding prolonged sitting. You know, we know that with prolonged sitting, our cortisol level rises, our blood sugar level rises, and that's not good for your brain. And just getting up for a short period of time, you know, walking around for a couple minutes and then sitting back down, you know, is a better way to set up your day. And I know with myself, I used to sit in front of my computer for hours on end. And then when I became aware of these studies, what I do now is I actually set a timer for 30 minutes. So I'll work for 30 minutes, then I get up and do something. And so I think what we need to do, you know, especially when we're under stress or our schedules are very full, we need to weave more physical activity into our days.
And we have a viewer who was asking if you would, I mean, should we be measuring our hormone levels, and then when they start to drop, should we take hormone replacement therapy. I know a lot of research needs to be done, but is this something that we should consider, knowing that hormones could impact our brains?
Mm-hmm. So at this point, there's really no role for hormonal replacement in terms of dementia prevention. The initial study that came out, the Women's Health Initiative back in, I think that was 2003, showed that hormones are not good for us, but there were a lot of problems with that study. The women studied were older, and they didn't start the hormonal replacement until like 10 years after menopause or more. I think it's even more. So since that time, we've been wondering, is there a window maybe where hormone replacement may be helpful? And the studies so far have been inconclusive on that. If you start it within, a very narrow window of menopause and use it for a short time. So there's a lot of research going on in this area for a woman who's having trouble with, hot flashes, menopausal symptoms, and it's interfering with sleep. Maybe that's something that should be considered, but this decision has to be made on a very individual basis, with your physician.
So, Marie, tell me, what do you recommend, since we know that, one gender, females are more at risk of Alzheimer's? What do you recommend we do? I mean, someone, you mentioned you had a mom who has Alzheimer's, as do I. We worry once you've been impacted by this disease, you naturally worry about your own brain health. So what is one to do when we're healthy? How do we assess our risk, and what should we be aware of?
So I think one of the most important things is staying on top of your physical health. As I talked about in that one study that looked at 7 modifiable risk factors, a number of those are medical issues: midlife obesity, hypertension, diabetes, smoking, depression, and insomnia. So it's really important for women to take care of themselves, be proactive. If you have any of those underlying conditions, make sure you're getting the best treatment you can get and get all those medical problems under control. And that will significantly decrease your risk of Alzheimer's. And I think the other thing is for women to get support. I know with my mom, I helped take care of her, and it was exhausting. Caring for my mom with Alzheimer's was physically, mentally, emotionally exhausting. And yet I had every resource one could ask for. I had, the knowledge base. I had the financial resources. I have a wonderful supportive family. My kids were raised. I didn't have to worry about losing my job when I took time off. And, my heart just goes out for a lot of my patients' families. So I'm the neurologist for the Mass General Health Centers, and we care for patients with kind of a low socioeconomic class, a lot of immigrant patients. And I have a lot of single moms who are, they have young children of their own, and they're caring for a family member, a parent with Alzheimer's. And I can't even wrap my head around how they even get out of bed in the morning, the stress level. And I think we really need to provide more support for caregivers and more support for women. One of the things we didn't talk about, one of the risk factors, is low educational attainment and staying cognitively stimulated. And that's worldwide, that's considered the #1 risk factor for Alzheimer's.
Is low education?
Low educational attainment and lack of cognitive stimulation. And, when you think about women in the US, traditionally, women don't have the level of education that men do. Even if we do, we often will kind of give up. We don't aspire to the more mentally challenging jobs because we're raising children or we have other responsibilities. And again, I can't help but think about my mother's generation, and those are a lot of the patients we're seeing now with Alzheimer's. And so hopefully now that women are becoming better educated, that will be, help lower their risk over time.
Well, it's interesting too, because, two things that you've mentioned, the two most important are the education and the exercise, right? And in the last 20, 30 years or so, that's vastly changed from, when your mother or even, I mean, my mom always worked, but, she was one of few. So it's going to be interesting to see how much the landscape changes given, these points. But I have a question for you. Is enough research going into studying women in relation to Alzheimer's disease?
We're working on it. As I said, it really is a women's disease, that women are more affected and we're the caretakers. And, previously a lot of studies in animals are done on male animals rather than female, so they don't have to deal with the estrous cycle and the hormonal changes. And as we've talked about, we don't know how important those factors are, but thankfully, we're recognizing that now. There is a greater initiative to do more women's research, and especially for Alzheimer's.
So what would you say is the most urgent, in terms of women and our health? What's the most urgent area to study in relation to brain health or Alzheimer's?
Well, I mean, hopefully we'll be coming up with some good treatments or cures, but until we do, we really have to focus on these modifiable lifestyle risk factors. And one of the things I want to emphasize is that it's never too late to make changes and improve your brain. Our brain has this incredible ability to make new neurons and new connections throughout our lives. And a lot of that depends on how we stimulate that brain and the type of environment we provide for our brain. So staying mentally active is so important. And it doesn't mean you have to, go to school, get a degree, just challenge yourself, step out of your comfort zone intellectually.
So, and we have a viewer who just wrote in, when all of these situational variables are controlled for, is Alzheimer's really still a woman's disease?
Yes, just because we're more affected, and again, we don't really know how much this will affect, what the impact could be if every risk factor was decreased. Again, we didn't talk about other risk factors. For example, we know that social isolation is a risk factor for Alzheimer's, for cognitive decline, and fortunately, that tends to be women's strong suit. Women tend to have richer social networks than men do. We tend to share things, be supportive, and that's really important. And this again is another thing that's so difficult to quantify.
So, Marie, tell me a little bit. You have first. Your book, Beautiful Brain, Beautiful You, that really dealt with brain health, right? What you can do. Tell us a little bit about what you address in that book.
So it's a 7-step guide to what you can do to keep your brain healthy and vibrant. And one of the messages of that book is, I think as women, we're often, so we think a lot about external appearance and that, but what a lot of us don't realize is that beauty really comes from within, and it actually comes from your brain. Think about when you feel kind of mentally cloudy or you haven't slept well. No matter how great your makeup is or your hair, you're just not going to have that sparkle in your eye, because that sparkle in your eye actually comes from a healthy, vibrant brain. And so that's the message of the book, to kind of do everything we can to keep our brain healthy.
And you're in, I think you're writing another book, is that right? What's your latest book on? Is it taking it further?
So it's called Outsmart Stress, and it's a guide for women and men too, but looking at what we can do to use our brain to outsmart stress.
Okay, give us the top 3 tips of how we beat stress. I certainly need them.
Well, one of the things we talked about is sharing our feelings with others. Never worry alone. That's some of the advice I give. There are a whole bunch of steps, and I'm not sure when it's coming out. Depends on how much stress I'm under over the next few months. But I hope to have it out by the beginning of the year.
Great. Well, we look forward to it. And thank you so much for your research. Thank you for focusing on gender. It's obviously an area that needs a lot more attention, why women are more susceptible to Alzheimer's. And, it's really not only Alzheimer's disease. There's a lot of conditions women tend to be more susceptible to, yet research is not at a point where it's just looking through the gender lens. So we're very appreciative of people like yourself who are really putting the lens on this and trying to understand what differentiates us in order for us to protect our brain health. So please keep us updated on your studies. I'm sure our community would be very interested in future.
Thank you. Thanks so much, Deborah. I really enjoyed this.
Thanks so much for joining us.
My pleasure.